So what we do when we do a hip replacement is we are effectively creating a new ball and socket mechanism so that you can regain that lost flexibility. You'll be able to once again tie your shoe, to do simple things in your profile of activities of daily living. Now you'll be able to do a lot more than that. I always get asked the question, what do you restrict me from doing? I say nothing. I mean, it's intuitive that you want to go out and run a marathon, you're going to impact load, and you're going to decrease the life expectancy of that implant, but it will tolerate it. It's kind of like the automobile that you bought. You can drive it for 100,000 miles and you know what it's going to look like, or you can baby it and you know it's going to look great. So I'm a caraholic. I don't drive my cars a lot. So if you want to go out and drive your hip, go ahead and do it. It'll tolerate it. And you'll be back for a liner change. But I can tell you that in the recent years, the materials have gotten so much better. My history with doing this extends over 37 years. And I started with some really poor plastic material that we call polyethylene. And it did not face the test of time. We then went to metal-metal articulations, thought we were doing really well. But again, there was a little issue with metal ions. And now we have a beautiful pink ceramic that doesn't fracture on a highly cross-linked polyethylene. And I am now seeing data that I can tell you 20 plus years of survivorship with average utilization of your hip joint. So if you're experiencing pain, decreased motion, getting harder to tie those shoes, get out of your car, get up from a chair, climb the stairs, whatever it is, come see us at JIS Orthopedics.